Good afternoon, and thank you for joining us today. We have a lot of developments that we want to cover, so we're going to get right into it. Yesterday, the Board of Supervisors held its regular meeting, and we received an update on our status of our state reopening tiers. The good news is that we remain in the red tier, which allows some businesses to go ahead and remain open with certain restrictions. Dr. Wooten's going to go into more detail on this soon, but again, we caution that we could fall back into a more restrictive tier if we let our guard down. We need to continue to take precautionary actions like wearing facial coverings, maintaining social distancing, avoiding large gatherings, and those types of things I think can help prevent us from losing the red status that we have right now. The other good news is we received a report that the state has released guidelines that allow municipalities to reopen playgrounds that have been closed for a long time. We know this has been a big issue for parents, and we are glad to see that the state has provided these guidelines, which includes precautions like sanitizing your hands before and after using playground equipment, and having children who are 2 years and older to wear facial coverings, also asking people to stay at least 6 feet away from those outside of their own households. I'm happy to announce that the County of San Diego Parks and Recreation Department immediately began working on signage with these guidelines, and we are opening up more than 100 county playgrounds today. Each city will have the responsibility of meeting these guidelines, and we are assisting them as requested to ensure safe reopening protocols are in place. In addition to that positive development, yesterday the Board of Supervisors unanimously agreed to expand our $5 million small business loan program from just the unincorporated area to businesses and cities throughout San Diego County. This program will provide assistance to businesses and nonprofits that have been suffering economic losses from the pandemic. We are also partnering with the San Diego Foundation on this program, so more information, if you need to gain more information, please visit sandiegobnlp.org. With that, let's proceed to our update. Again, as I mentioned today, we'll have Supervisor Fletcher, followed by Nick Mascione, the director of our T3 program, who will talk about health equity testing strategies. And then we're honored to have with us today Dr. Paul Gothold, the superintendent of the County Office of Schools. And then Dr. Wooten will give us the latest public health updates. Supervisor Fletcher.
Thank you, Chairman Cox, and good afternoon. We know over the last few weeks the focus of attention has been around the state levels, the red tier, the purple tier, and the impact that it will have on businesses. But we have continued a very diligent and focused effort to try and support our schools. Our schools are trying to reopen safely in a responsible way for parents who choose to send their children back to some form of in-person school. And there's obviously a lot of different schools throughout San Diego County. We have 42 different school districts. About a dozen of them have opened some form of in-person instruction in varying degrees and scales. In addition to that, a number of charter and private schools have also reopened, and there are many more school districts that are in the process, of trying to assess how they can safely reopen in some configuration so that parents who choose to send their kids back might have that option. We've been working very hard as a county to try and support our schools throughout this endeavor, and as we move forward to make sure that we are there to be a resource and an aid and assistance, not only in terms of their plans and providing technical assistance around the public health challenges they face, but in particular around supporting the efforts around testing. And today we're going to hear from Dr. Paul Gothold, the superintendent of the County Office of Instruction, which has been a tremendous resource to us as a kind of coordinator of all of the schools in the county around the efforts that we're taking in. We're going to hear from Nick Mascione, our T3 director, around what we're doing. I think it is important to point out that although the state guidance puts the onus on schools for testing of personnel on the schools, we believe it is important as a county that we step up to help them meet this goal. And to that end, we have put in place the ability to have dedicated testing for school staff and personnel who are there. State guidance says that schools shall test their staff, and then they make a recommendation on how frequently. Essentially, all staff members of the school should be tested every 2 months. and that can be broken into whether you do it half each month or a certain percentage each week, providing the testing is available. For teachers and school personnel, all school staff, we have 4 dedicated testing sites throughout the county that are there exclusively for school employees and school personnel. And we've worked closely with San Diego County Office of Education to site those and staff those and make those available. We also have made available testing at all 41 of the county-sponsored testing sites for any school personnel who would like to get their tests there. And so we are working to meet the need and ensure that our schools, as they move forward, have the access to make sure that their staff meets the recommended testing and the required efforts of the state of California. As it relates to testing students, there is no state requirement on testing students. It is recommended, and we are working to do everything that we can as a county, and you'll hear more from Nick in a minute on that. We have multiple options for children whose parents want them to get a test, both the Rady Collaborative for Kids, which we announced many months ago, obviously through your existing healthcare provider. But beginning in October, children will also be able to get tested at the 41 testing sites throughout the county, and we will make that available as well. And so we are working very hard in great partnership with Dr. Gothold, the County Office of Education, to provide the resources, again, both to the 42 public school districts in San Diego County, but also to the private and charter schools throughout San Diego County. As it relates to the tiers, once a school is open, even if we were to tip into a higher tier, it does not require their closure. It does have some impact if you have not opened by that time. You still have the waiver process for elementary school and some other things, but we will continue to work to try and support them, and you'll hear more about that both from Nick and from Dr. Gothold, who are here today. Let's jump into our daily report. We're going to start with our medical lab processing times. This was obviously been a big issue historically. We started in the early days, we were doing very limited testing, ramped up considerably. That put a significant strain on supply chains, and you saw the turnaround time spike significantly, more so for commercial labs and state labs, but we've worked hard and are pleased to report that the average turnaround time, again, you see there for our hospitals, between 1 and 1.5 days, our public health labs between 1 and 2, our county partner, or Helix partnership, between 1 and 1.5. The state walk-in labs are now between 1 and 2 days. You remember it wasn't that long ago. Those were 8, 9, 10 days. Our FQHCs, our clinics, again, right on par with our hospital systems. And the commercial labs still lagging a little bit behind, but still considerably better than where it was in the past. And the turnaround time is important in order to maintain the efficiency of the contact tracing system. Next, you will see our 7-day average of tests reported, 9,357. Obviously, good increase in the last few weeks in terms of the number of tests that are being done, but we've been able to increase the number of tests we're doing without impacting the turnaround time, and that is a positive accomplishment. 14-day average, 3%. You see total tests there well over 1 million. Case investigations and contact tracing continue to do well in terms of how quickly we can reach out and contact folks, and you see the treatment numbers on the right-hand side. For our positives today, we're reporting 195 new positives today. Significant number of tests and batching came in there for 2% percentage of positive. It is really important to point out that the metric we focus most on is that Tuesday number that comes out from the state of California. That number is derived from date of illness onset with a 7-day lag. The numbers we're sharing with you here are the daily positives based on when we get the test results back. And so you can't take the information on this chart to calculate that number. This is based on the date that we get it, but we will, of course, continue to share, and you can see where we've been over the past few weeks. Down under 200 today, 251 yesterday. We've certainly had some day-to-day variance in terms of the numbers, but again, the state numbers are based on date of illness onset, so these individuals are contacted. When did you feel sick? If they can't determine that, what date was your test done? If you can't do that, then they do ascribe it to the date the test came back. Next chart you'll see on COVID hospitalizations. ICUs are down 74. Total hospitalizations at 250. Again, holding generally steady. Down a little bit from where we were a few weeks ago. This is certainly encouraging. Next slide, you will see our COVID hospitalizations there at 250, with non-COVID there at 4,404. Again, that total hospitalization holding relatively steady and flat across the board. Before I bring up Nick, I just want to walk through one slide here on testing to walk through some of the information I shared earlier around testing. This is the guidance from the California Department of Public Health, who should be tested and how often. They say that school staff who are going to have contact with other students or other staff, these are both teachers, paraprofessionals, cafeteria workers, janitors, bus drivers, that they shall be tested, and then they recommend that they each be tested every 2 months. And they provide a few different formulas on how you can do that. It is with the caveat provided the testing is available and is practical, and this is a doable thing for us here in San Diego County, which is why we've worked so hard with the schools to set up the dedicated testing sites for school personnel, and then to make all 41 of our county testing sites available and accessible to school personnel. And again, we are, even though it's not a requirement, we are working to make testing available to students, both our Rady Collaborative through their existing healthcare provider, or beginning in October, children will also be able to get tested at any one of our 41 county sites. And so we're going to continue to work to do everything that we can to support our schools as they try to safely reopen for parents who would choose to send their kids back. To give a little bit more information on that, we're going to hear first from Nick Mascione and then from Dr. Paul Gotthold. Nick?
Thank you, Supervisor Fletcher. In partnership, if we can get that slide, in partnership with the County Office of Education, the county is going to provide, as the supervisor mentioned, 4 walk-in sites dedicated to school personnel only. We're going to be offering these free PCR diagnostic tests. And you can see the schedule here, starting tomorrow, with a location in Chula Vista, one in City San Diego proper, then on the 2nd in Del Mar area, and on the 5th in El Cajon. And I want to just say that this was through really the great work of Dr. Paul Gotthold and his team in helping identify these locations and working with all of our superintendents throughout schools, and he'll talk a little about that in a moment. Now, all these school personnel sites will be available without an appointment, and that's really to maximize availability. Teachers' time matter, so we want to make sure people, as in all of our sites, are in and out right now within 5-10 minutes of coming to our sites. Also, the school personnel are going to be coordinating with their individual schools, and Paul will talk about that in a moment. In addition to the 4 school dedicated sites, we're working with our great partners in CAL FIRE. CAL FIRE has partnered with school districts, again through the coordination of the County Office of Education, in our rural communities. More challenging for our far distant schools to come more into the more urban areas. So we're going to go out to those school areas, and we'll be setting up some of our testing sites coordinated, again, with the rural community schools. Our school personnel are also able to access free tests, and this is really important. We have 41 testing sites we're expanding. So in addition to these 4 school testing sites, our rural testing sites, we have testing sites throughout the county, and school personnel, indeed, with parents and their children, can go to any one of our sites. We are now moving them into, with the exception of really a handful in our information 211, all of them as to being no appointment drop-in sites. So trying to make it as easy and accessible to San Diegans. Now, as it relates to children, testing of school-age children is critical for their safety and for the in-person learning, as has been discussed. It's always recommended, when we talk about for children, that parents first check and consult with their child's pediatrician or family health provider for testing advice. The county has partnered with Rady Children's Hospital in the creation of the COVID Collaborative for Children, which is expanding testing capacity for children by the Rady network countywide, and it includes the family members and households of that child, even if they are uninsured. We will provide that test for free. Most students and their caregivers can receive the COVID-19 test, in fact, through Rady's. But again, we're encouraging parents to check with their healthcare provider. You can see from the screen where to access information if you're seeking to get information from the Rady Children's Network. For the Kaiser Permanente members, you must consult with your Kaiser Permanente physician, and we provided the information there so you can make that coordinated effort as well. And students should always, again, for us and the parents of children, encourage that that the parents also consider getting their testing. If you come to any of the Rady sites, again, we will provide that testing for the parents when that child's getting their COVID test as well. In our efforts to expand additional testing sites where school-age children under the age of 12 can get a free COVID test effective tomorrow, October 1st. The county now will be offering free testing to school-age children in grades K through 12. Prior to, until today, we were only doing testing to 12 years of age and older. Now we're going to cover all age groups from K to 12, starting tomorrow. A parental consent will be required for children under the age of 12. That's a state law. So, and for more on issue of children testing, we're really excited about board challenging us, the subcommittee challenging us to expand even more on testing, and we're working diligently, and we'll be announcing in the coming weeks of being able to test children as young as 6 months and older at all of our county and state testing sites. So we're trying to improve, again, all accessibility, making it easy for parents with young children to come get tested. Now I'd like to turn it over to our great partner, Dr. Paul Gothold, the superintendent of the County Office of Education, to talk about our work that we're doing with the schools.
Thank you, Nick, and thanks again for your partnership and work that you're doing to support our schools. As Nick had mentioned, 4 regions being set up as we speak, and really we have a task force within our office that are coordinating efforts with all 42 districts, 160 plus charter schools and our private schools to ensure that we have a seamless process of getting our folks in, getting them tested under those metrics recommended by the state, 50% of all employees, 1 month, 100% every 2 months. So you can imagine the Herculean task when you talk about over 80,000 school employees and navigating this. I do want to make sure that that it's mentioned, and to be clear, we don't have those schedules built out yet. They are forthcoming in the next few days. But more importantly, the commitment that this Board of Supervisors and this county has made has my colleagues and county superintendents across the state green with envy. This commitment doesn't exist in other areas of the state where they have put not only the in-kind support, facilities, funding behind something that is so important, and it truly demonstrates the commitment that our County Board of Supervisors, our County Health has in ensuring that our students and staff are safe. So we thank you for that.
Thank you, Dr. Gothold. And again, as Nick Mascione said, I don't think we could ask for a better partnership and cooperation with the County Office of Education. And through the County Office of Education, all 42 school districts in San Diego County are really closely aligned with the county in our efforts to do the testing and to try to make sure that we responsibly respond to this pandemic that we've been dealing with. Next up is Dr. Wilma Wooten, who is our Public Health Officer, to give us the Public Health Officer's report. Thank you.
Thank you, Chairman Cox, and welcome everyone to today's briefing. As of today, there are approximately 34 million confirmed cases worldwide, and today we've reached a milestone of 1 million deaths, over 1 million deaths. Nationwide, there are over 7.2 million cases, which includes over 206,000 deaths. And today, our local case count is 47,180 cases, which is 194 more cases than yesterday, which is a decrease in new cases since yesterday reported as 251 cases. This overall total number of cases includes 783 deaths, with 2 new deaths reported since yesterday. Now, in the next slide, shows, actually, this is the demographic slide, and I'll be talking more about this in a few minutes. But if you go to the next slide, I wanted to show the COVID-19 rates by zip code of residents. And this basically shows that we have the greatest number of cases in our South region, as well as the Central region. So this was no surprise, but this is the graphic depiction of that. Now, if we can go back to the slide before, regarding case demographics, thank you. The age range of cases is from approximately 1 month to 102 years of age. The 20 to 49-year-old age group remains at 58%. And 24,143, or 51% of our total number of cases, are female, 49% are male. 3,525, or 8% of the cases, have been hospitalized, and 822 of those hospitalized to the ICU. This number is 2% of the total number of cases and 23% of the total number of those hospitalized. The total number of cases includes, again, 783 deaths, which is 1.7% of the total number of cases. So if you can fast forward, yes. This next slide talks about COVID-19 demographics related to hospitalizations. The majority of the 3,525 total hospitalizations, which is 2,526, or 72% of the cases, the 50 years of age and older age group. So again, the majority of those individuals that have been hospitalized are 50 years of age and older, and this represents, again, 72%. Males represent the majority of hospitalizations. Hispanics and Latinos represent the majority in terms of race and ethnicity at 2,030, or 61%. The next slide speaks to further demographics related to deaths. 340, or 43%, are female, and 443, or 57%, are male. COVID-19, if we go to the next slide, COVID-19 is the 6th leading cause of death in San Diego County as of the data on September 24th. And this information obviously is subject to change, and we will report it on a frequent basis so we know where we are with these leading causes of death. There were approximately 680 state-registered COVID-19 deaths among San Diego County residents, which places us again as COVID-19 is the 6th leading cause of death between chronic lower respiratory conditions and accidents or unintentional injuries. The process for registering deaths at the state level can take several weeks, and thus the number of state-registered deaths due to COVID-19 is lower than the actual number identified locally. And also, this is as of September 24th. However, in order to compare COVID-19 deaths with other causes of deaths, it is necessary to use the state-registered deaths process. And this time lag will not affect the order, as all other causes of death will experience the same time lag and go through the same process. So also, 747, or 95% of the total deaths had underlying medical conditions. 35, or 4%, had no underlying medical conditions, and 1, or 1%, is still pending. And in this slide, this shows the common underlying medical conditions associated with the COVID-19 deaths. So as we have reported previously, hypertension, diabetes, and cardiac disease are the top 3 underlying conditions and for COVID-related deaths. And keep in mind that some people have more than one underlying medical condition, so this is why the total percentages do not equal to 100%. So as always, the County of San Diego would like to extend its sincerest condolences to the family, friends of individuals that have lost their lives due to COVID-19. And all of our data, the information we've shown here today and more, can be found on www.coronavirus-sd.com. Now let's move to our triggers dashboard, and as you will see here, our only abnormal trigger is community outbreaks, and that has been abnormal probably since late June, early July. And but I also want to point out on the right side of the slide the results for our case investigations and contact tracing, which is above the goal or target for 90%. So we are well above those that target for each, 90% for case investigations and contact tracings, and we are at 97 and 95% respectively. Let's move to the next slide. Today, we are reporting 34 total community outbreaks for the past 7 days from September 24th to September 29th, which also represents 141 cases. And currently, we have 34 total community outbreaks, with 14 being reported just today. And in the next slide, this lists the various settings that these outbreaks are in. 7 are in businesses, 1 in a food processing facility, 1 in a gym, and 5 in restaurants. Going to the next slide, let's move to the new tier system that has been rolled out by the state under the Blueprint for a Safer Economy. The tier framework lays out the metrics and thresholds that each county must meet in order to open more sectors and parts of the economy, and shows tiers based on risk of community disease transmission, from widespread, substantial, moderate, and minimal. We are in the red tier, which makes us have substantial spread throughout the county. And as you can see to the right, the threshold for case counts or case rates is 4 to 7, and for positive tests, because we are actually, for positive tests, we are in the moderate or orange category. We have, it's between 2 and 4.9%. And we'll go over the specific, our specific numbers in just a minute. So if we go to the next slide, as of yesterday, I think everybody knows that we still remain in Tier 2, or the red tier, and there are still only 2 additional counties also in the red tier that are bordering San Diego County, and those 2 counties includes Riverside and Orange counties. And again, being in the red tier, or Tier 2, means that there is substantial spread or transmission of COVID-19 throughout the county. In this next slide, the metrics framework includes case rate and testing positivity, but equally important is the state's testing rate. The state's testing rate per 100,000 population is currently a median rate, 216.35 per 100,000 populations. That is the state's median testing rate. This testing rate is used to calculate the adjusted case rate. If we are above the state's median, the county case rate is adjusted downward to a lower case rate. And if a county goes below the state median testing rate, the county's case rate is adjusted upward to a higher case rate. For the period of September 13th through September 19th, San Diego County's new COVID-19 positive cases per day per 100,000 population was 7.2, and the adjusted case rate dropped to 6.7 cases per 100,000 population, which keeps the county in the red tier. The testing positivity continues to be in the orange tier, or Tier 3, and has decreased from 3.8% to 3.5% since over the past week. However, the state goes with the more restrictive tier. That's why we are in the red tier. The California Department of Public Health will assess counties on a weekly basis, and the next report is scheduled for next Tuesday, October 6th. And you can find more information about the state's Blueprint for a Safer Economy at covid19.ca.gov. So in closing, we can all work together to make a difference to decrease the spread of COVID-19. The prevention strategies on this slide are critically important in determining the future trajectory of the COVID-19 pandemic picture in San Diego County until a vaccine is available to achieve herd immunity. These strategies include washing your hands and promoting sanitation practices, staying 6 feet apart from others, wearing a face covering, avoiding crowds, and most importantly, staying home if you are sick. And last, these strategies directly impact the testing positivity and the case rate. This is why this all matters, because if we do these things, we can continuously decrease our testing rate and decrease our case rates. So with that, I want to remind all San Diego County residents to please continue to do your part to slow the spread of COVID-19. Now please welcome back to the podium Chairman Greg Cox. Thank you so much.
Thank you, Dr. Wooten. We'll go directly to the questions.
This first caller is Lauren Mapp with the San Diego Union Tribune.
Hi, thank you. In recent months, experts have said they are concerned that the lack of hands-on visitation in nursing homes and assisted living centers could be causing severe health problems. Has the county noticed an uptick in non-COVID related deaths in these facilities?
Okay. Dr. Wooten is going to respond to that, I guess. Thank you.
So I just want to clarify your question. Have we noted any non-COVID related deaths? Is that the question?
Yes, an uptick in non-COVID related deaths in skilled nursing facilities or assisted living facilities.
Well, I am not aware of an uptick in non-COVID related deaths. Actually, we have been looking at overall deaths for the past 5 years, and particularly focusing on the 3-4-50 deaths, which includes cancer, heart disease and stroke, diabetes, and lung disease. And actually, overall, at least at the last time we looked at these data, the number was less compared to the same time in the previous years. But again, to actually answer that question, we would have to go back and look at that overall data. But I do not believe that that has been the case. Thank you.
Thank you.
Okay, next question.
Next caller is Sasha Fu from KUSI.
Hi, I have a question about schools. In the past couple of weeks, some schools have opened for in-person learning. A few of them have had to close because of an outbreak of the virus. Is there a general guidance on when a school has to close because of an outbreak, or is that at the discretion of each and every individual school?
Okay, Dr. Wooten's going to respond.
Good afternoon, Sasha, and thank you for that question. To date, I am only aware of an outbreak in our institutions of higher learning. I'm not aware of any outbreaks in our K through 12 setting. The state, though, is very clear on the guidance for closure. And as I think, if schools are now open, when jurisdictions are in the red, they are open. If jurisdictions move to the purple tier, those schools that are open continue to be open. And so closure is predicated on outbreaks. If there is 5% of staff, students, and other personnel in a school, then that school is recommended for closure. If there is 25% of schools in a district that have an outbreak, then that district in general is recommended for closure, but other circumstances, depending upon the size, might require a different outcome. But those are the recommendations from the state. Dr. Gatto, is there any other?
Yeah, I wanted to ask, can I ask about the word recommendation? If they meet those, the 5% that you cited or the 25% in the district, you said those are recommendations, so the school district might have some discretion about saying, well, we will ignore the recommendation because it's not a strict mandate?
What we said is the state requires testing. The recommendations are for how frequent the testing. So the stats that I just gave are percentages of outbreaks that would determine closure, which is something totally different. And those are not recommendations. Those are actual required guidance that we should go by. Dr. Gatto?
Okay. I think I might have misunderstood. Thank you for clarifying.
Yeah. I think when you see these instances of classroom closures, where a classroom is quarantined for 14 days, and that's based on the 5% metric, a lot of those have been the result, not necessarily of an outbreak or a case, but the potential exposure that someone had through the contact tracing process. And then those are cases where the classroom actually shuts down for 14 days in an abundance of caution. They pivot to distance learning and come back, but the case didn't actually originate or was present in that particular class.
Thank you.
Okay, next question.
This next question is from Brandon Lewis with CBS 8.
Thank you. I have two questions. The first is, over the summer, we saw some delays at labs. And with the increase now of testing of school personnel, how will the county ensure labs aren't overwhelmed and results delayed?
Okay, I believe both Supervisor Fletcher and Nick Mascione are going to respond to that.
Yeah, thank you for that question. I think in the outset of our response to coronavirus, we obviously ramped up significantly the numbers of tests we were doing, and that really put a strain on the supply chain in terms of the parts and all of the components you need to successfully execute on that test. And you'll remember back a while, we saw a significant rise in the turnaround time. We moved rapidly to try and address that. We obviously brought on Helix. We did other things to get those down. And as we come back now, if you go back to the chart I shared earlier, you'll see our turnaround times are really good. And we are mindful that as we again try to increase testing, you can see right here, even with the increases we've seen in the last few weeks, the turnaround time is very positive and right where we need it to be. But we are mindful that as we continue to increase testing to support our schools and support universities, along with expanded testing in the community, we have to be mindful that we are very vigilant on this turnaround time. And so we think there's obviously more capacity now. There's more testing coming on board. There's more supplies. It's getting a little bit easier. But as we ramp up, we're going to be very mindful of keeping an eye on those turnaround times.
Thank you, Supervisor Fletcher. And I also wanted to ask, we noticed Los Angeles County announced plans to hold Comic-Con at its convention center in December. Any idea when San Diegans may be allowed to have conventions, or and if you have any thoughts on their safety plans that are being used in LA?
Now, Dr. Woon's going to answer the Comic-Con delay. I just want to add to your first part of your question, to add to Supervisor Fletcher. One of the things we did with Helix intentionally was to diversify our testing capability. We're going to go to 41 testing sites. We're right now averaging about 2,000 tests a day with Helix. That's going to go to 4,000 tests a day with Helix. You may remember they received a big NIH grant to become a super lab to do a lot of testing. So we're really fortunate having that partnership. In addition to Helix, even before them, with Rady, Children's Network, our great partner, Rady's, they have also built the capacity and have not met that capacity. They're about maybe even half of what they're able to do. So we are in good stead in our county of having both our Rady's network, our Helix, and our own public health lab, as we've been building capacity to do that, to handle not just for the school reopenings, again, but for also the general public. With that, I'll turn to Dr. Woon to answer your question on Comic-Con.
Thanks.
Thank you for the question about Comic-Con. The state has not actually given guidance about large events or conferences. Before they transition to the tiered system, the expectation is that would occur when we achieved herd immunity. But in the interim, we are working very closely with the convention center so that when the state does give guidance about convening such an event, that they will be ready to meet the challenge of such a large event. But currently, there is no guidance on large conventions such as Comic-Con.
Thank you, Dr. Wooten.
We have one final call-in question.
Yes, this last call-in question is from Paul Sisson with the San Diego Union Tribune.
Thank you. My first question has to do with playground guidelines, the new guidelines that just took effect today from the state. They mandate a lot of different things: face coverings, physical distance between household members, visits limited to 30 minutes, no eating or drinking on playground areas, et cetera, et cetera. This is a lot to kind of keep an eye on. does the county recommend that cities have some kind of supervision out there, be it a city staff person or what have you, to make sure that people are following all of these rules?
Okay, Dr. Wooten's going to respond.
Paul, I reviewed the guidance yesterday, and I do believe that there is recommendations about having someone at the facility, because the playground, the equipment needs to be washed down or sanitized on a frequent basis. So the parents aren't going to do that, but what they are being recommended to do is to use hand sanitation before and after utilizing the equipment that's on the playground. But what's being asked is no more than what that slide that I showed you in terms of the major things that need to take place: washing your hands, or not, if you have access to a bathroom, but or using hand sanitation, the staying 6 feet apart, wearing face coverings for children that are 2 years of age and older, and also maintaining activity in one's household. We know that there are going to be some guidance for gatherings coming out, but for right now, that's the guidance. And so these are the recommendations to utilize playground equipment in a safe manner.
So fair to say that the county at this point feels like cities might have to be involved in sanitation operations, but not so much in policing these guidelines?
Well, every jurisdiction, whether it's a city or our county parks and recs, will have to develop their plans, signage to instruct individuals that utilize the playgrounds. People have to change their behavior. They can't go back to the behavior that was exemplified before COVID-19. So these are the behavioral changes and recommendations that need to be made in order for children to get physical activity and to safely utilize playground equipment. Thank you.
Thank you, Dr. Wooten. And one final question. Have you guys detected any more positive cases at UCSD since they started bringing students back to campus?
I'm going to ask Dr. McDonald to come up and address that question.
Thank you.
Thanks for that question, Paul. The total number of cases that have been referred to us by UCSD in terms of their baseline testing for individuals who are arriving is less than 10. That was as of yesterday. I know that, again, that's a number that's higher than 3, so it sounds like it could be an outbreak, but because these are individuals that are coming in and being tested upon arrival at baseline and don't have epidemiologic connections before arrival, that does not meet our definition of an outbreak, so it's still under 10.
That's pretty low for thousands of kids coming back. What do you think is working there at UCSD, and also, has there been any sign of spread from the SDSU outbreaks out into the general community, or is it still, your investigations still show that it's quite contained to people who know each other through education?
Two very interesting questions. Again, many of the students before they came to UCSD were asked to socially distance and relatively quarantine themselves before arrival. So I think that that's probably contributing to the low percentage of positives that they're detecting so far with this baseline testing at UCSD. I will note that other large universities across the country have seen similar findings, and it doesn't mean, and I don't believe that UCSD is letting its guard down in terms of saying, oh, if you come in, you're okay, that means you can do what you want. It means that they need to be rigorous with sticking with their social distancing and hand washing and mask wearing, and their plan of repeated testing over time. So I think, again, they have a very strong plan in place at UCSD for their students. For SDSU, there are no confirmed cases today that were part of the total that was reflected in today's numbers. And relatively recently, we've again had very few cases reported from SDSU. If you look at that zip code and the increases in that zip code over the last number of days, those numbers have also been relatively low. But we are looking very closely to see if we can make any connections between any SDSU students and any individuals that they've come in contact with, either in the close vicinity of the school or across the county, to see if we have any indication of spread into the community. Right now, the evidence of that is extremely low.
Thank you, Doctor.
And Dr. McDonald, if you could stay up there, we have several questions related to universities via text message. This first one is from Jack Mulmood with News 8. Do any of today's cases come from universities, is the first question he's asking.
So no, none of today's cases come from local universities.
And then his follow-up question is, University of San Diego is reporting 40 student cases in the last week. Do you have any information on those students, such as the symptoms or if they attended in-person classes while they were contagious?
We're working closely with USD and their student cases. If you want to keep up with the cases that they're reporting, you can go to their website. They actually have a dashboard in which they indicate the number of residential, non-residential, and staff cases that are cumulative in their university community since the middle of August, which is when I think their semester began, August 16th, I believe. So they have reported more cases in the last week and a half, but most of those cases are in fact off campus. We are aware of one cluster of cases that are USD students in an off-campus apartment complex, and we are working with that complex and those students to make sure that all their close contacts are identified and there's no further spread. But it does not appear that there are any cases related to educational activities on the USD campus.
And Dr. McDonald, this next text question is from Mike McKinnon with KUSI. Can you tell us what the cycle threshold is for the PCR tests administered by the county?
Wow, that's a very technical question. I'm not a laboratorian, and I'll give you a general answer, but if you need more specifics, please follow up with us, and I'll have you connect with our public health lab laboratorians. But a CT value is a cycle threshold, or CT. Some systems use something called a cycle number, or a CN, or a cycle quantification, CQ. So you'll see all three of those designations. And what that means is for tests that use a procedure called nucleic acid amplification tests, NAT tests we call them for short, those tests use technology to amplify the DNA or RNA of the target that you're looking for. In this case, it's RNA from this virus, and they amplify it over time. And the CN, CT, or CQ number is inversely related, that is oppositely related to how much you start with. So the lower the number, the higher the amount of virus that was initially present in your sample. So the answer to the specific question is, it depends on the platform that is being used, what CN, CQ, or CT number is being used as a cutoff for what is a positive test, what is a negative test, or what might be reported as an indeterminate test. In general, when numbers are less than 30, that is an indicator of a lot of virus being present, and that's a positive test. When you start seeing numbers over 35, 37, into the high 30s, that's generally a number that indicates a negative test. But depending on the platform, there might be some area of indeterminate tests that are resulted. Again, why is this important? Why am I going through this detail? It's because, again, people are concerned that the cutoff that is used might be leading to false positive tests being reported. And I will tell you that the tests that we report in our daily briefings are confirmed tests. That is, are tests that we get a lab result on and that we do an investigation on. And we are actually able to determine in some of those cases that those are in fact false positive tests that are not counted in our confirmed cases that we report here. And I know that some people are concerned that we might be overcounting or not being aware of the possibility of false positive tests. But I assure you that we are very aware of that and that we do investigate these cases before we confirm them and put them into the stats that we report here on every day.
Thank you, Dr. McDonald.
This next question deals with the discussions with the state of California on their metrics, and Dr. Wooten's going to respond.
And this question is from Tanya Thorne with KPBS. What is the status of negotiations with the state in considering current COVID metrics and rates to be able to reopen more businesses and raise capacities in those businesses?
So that question is a bit different from what we are actually doing. Early on, we requested an adjudication process to look at our testing rates, because the state wasn't capturing all of the tests that we were conducting. So we have been working with them very closely, and we feel that that situation is coming to a resolution. The second thing that we were working on with the state, and not just San Diego, but all local jurisdictions across the state, is looking at the metrics for the adjudication process. What could we use to help improve the adjudication process? And the first thing we started out was with the state's median testing rate. It used to be an average, which means that it would change every week, so they made it a median, and that was based on the recommendation from health officers around the state. So that was the first thing that was changed. And then we have been asking about, and you will notice that the state moved nail salons to purple tier from the red tier, and we've been asking about other types of businesses, but have not made much traction on that. But that was not our focus. Our focus was looking at the metrics and to determine how could, what were the best metrics to use. And again, as I've said on numerous occasions, case rates, well, first testing positivity, and then case rates is upstream. So it's very important to look at those things first. Just because they are not, there are other metrics that are not the core metrics. Other metrics like hospitalizations are being looked at for all of the counties, and those data are being followed. What we have been doing as local health officers is getting or asking the state to utilize those metrics to help contribute to a better adjusted case rate. So those conversations are constantly in process. And then with the health equity metrics, that has taken various evolutions, and hopefully that will be unveiled later this week. And the good thing about the health equity metrics is there is nothing related to health equity that will push you into a more restrictive tier. It has only been set up to help improve one's status and to go to a less restrictive tier. So those are the discussions that we've been having with the state to date. Thank you.
This last question deals with the availability of walk-up testing sites, and Nick Mascione is going to respond to that question.
And this question is from Lindsay Winkley with the Union Tribune. Are all of the county's testing sites walk-up, or do any of them still require appointments?
Lindsay, thanks for that question. Of the 41 now testing sites, the 4 that are school-only will be coordinated through the school. That's school personnel. The 37 remaining of our sites are appointment preferred, but all are walk-in. And why do I say appointment preferred? If folks need a certain time, we're going to still allow that. They'll be able to go on 211, and they'll be able to register for that time, for that location and that day. But other than that, all our sites are going to be walk-in with no appointments. Thank you.
Well, thank you all for joining us today. Before we go, I wanted to take the opportunity to make a couple of announcements and remind people that obviously we're expecting some very hot weather over the weekend. As such, the county has 9 cool zones which are open for people who need to escape the heat. COVID safety measures will be in place at these cool zones, and for more information, we would ask you to please get online at coolzones.org to get those specific locations. Lastly, I know it's been a tough year for everyone, but I wanted to highlight one piece of what I think is some very good news, and that is our San Diego Padres made the playoffs for the first time since 2006. They are playing as we speak, and though the score is not exactly what we want right now, it's only the bottom of the third, and the Padres are behind 6-2. 6-3. Well, hey, we're doing better already. So with that, I just wanted to say that in these difficult times, it's great to see the Padres have some real success and some joy and excitement for all of us here in San Diego, and we certainly wish them the best in this wild card playoff series. So go Padres. With that, we will close today's briefing. We'll be back here next Wednesday at 2:30. And again, please stay safe, San Diego, and wear those facial coverings and keep that social distance. Thank you.